Good evening, everyone. So, welcome to City Hall. Welcome to our lactation hearing, Bill 18-0276. We have members of the committee here. To my left, we have Vice Chair Robert Stokes, and we have Mary Pat Clark, member of the committee. Bill Henry, member of the committee.
Thank you, Madam Chair.
All right, and then we have members from the Office of the President, which is Michael Huber. Representing the Mayor's Office, we have Karan Banks. And we are good then. Lactation accommodations in the workplace for the purpose of requiring certain employers to provide certain lactation accommodations, including lactation breaks and locations, and to develop, distribute, and implement certain policies and procedures for providing these lactation accommodations, establishing minimum standards for lactation accommodations, defining certain terms, providing for certain exemptions, and authorizing certain waivers or variances under certain conditions, requiring employers to maintain certain records, prohibiting retailer or discriminatory action against persons exercising rights under the ordinance, authorizing the adoption of administrative rules and regulations to carry out this ordinance, providing for administrative and reviews and remedial relief for violations, imposing certain criminal penalties for violations, providing for a special effective date, and generally relating to the required provisions of certain lactation accommodations for employers. This bill was introduced on August 6, 2018. I was the bill sponsor, me, Shannon Sneed, and I just want to say that this is a bill that really was supposed to help families, especially women who were heading back to work, who didn't want to really give up work and worry about their kids. I think this is a great bill that will allow them to know that, one, their babies will be taken care of because they're able to provide, they're able to lactate, and their babies will be healthy. So thank you all for coming out tonight, and we are going to get started. So we're going to now hear from our agencies. We're going to start from General Services, and we're going to hear from Ryan Trout.
Good evening. Thank you, Madam Chair, members of the committee. As you mentioned, I'm Ryan Trout from the Department of General Services, and we stand by our report and support City Council Bill 18-0276. And I just want to point out a few things in our report for the Council, which is that DGS has taken a proactive approach to lactation accommodations by providing numerous accommodations already in city buildings, including City Hall, the Abel Woolman Municipal Building, the Benton Building, Health Department Headquarters, and the Fleet Maintenance Facility out on Biddle Street. And so based on our reading of the proposed legislation, each individual unit or department of city government that has 2 or more FTEs will be responsible for the development of their own lactation accommodations, and DGS would be happy to work alongside the agencies to provide those accommodations, whether it be designing a new room or providing some type of temporary lactation accommodation. So once again, DGS requests a favorable report.
Thank you. We'll next hear from Finance.
Good evening, Madam Chairwoman and council members. My name is Caroline Sturgis, Deputy Budget Director with the Finance Department. Our office has reviewed the bill and submitted a written response of our position. In summary, we anticipate limited costs associated with implementing the proposed legislation within city government, city agencies. The Department of Finance does support the bill. However, the Finance Department takes no position on the fiscal impact for private businesses. Thank you.
Thank you. Office of Civil Rights. Is anyone here?
Good evening, Madam Chair and other members of the City Council. I am representing the Office of Civil Rights and the Community Relations Commission. My name is Ray Peratt. I'm the supervisor of the Community Relations Commission. We enthusiastically support this bill. There are a couple of amendments that we did recommend in our response, given that there are a few things that are in conflict between Article 11 and Article 4 as currently proposed. But besides those things, we think this is a great idea and it's a long time coming for this.
Thank you. We'll now have Department of Law.
Good evening, Madam Chair, members of the committee. Elena DePietro from the Law Department. The Law Department is mostly okay with this bill. We had one amendment on page 10, lines 10 through 18. We request that they be removed from the bill because the city, unlike a state entity, is not allowed to create a cause of action in our legislation. So that's basically what this section would do. So we're asking that it be removed.
Thank you.
Madam Chair?
Yes.
Good evening. It's actually, I wanted to follow up with you, Mr. Petro, about this. So could you go into more detail in terms of why giving the Community Relations Commission the power to make these awards, what is it that we're not allowed to do?
We're not allowed to create by ordinance a cause of action. So anytime you're authorizing someone to get damages or attorney's fees or things like that, you're actually creating a cause of action.
So if that was the case, could that mean we just strike 14 through 18? Or just back wages and reinstatement?
That's all. It all falls into the same category.
All of that falls into the same
Anytime you're
category.
authorizing any kind of damages.
Okay. So how do we get that? Would that need to be the state would have to pass?
There'd have to be state enabling as legislation.
State enabling? Okay. Are you already got that? Yeah. Okay. All right. Thank you.
Next, we'll have the Department of Human Resources.
Good evening, honorable members of City Council. On behalf of the Department of Human Resources, I rise in support of the Baltimore City Council Bill 18-0276. This legislation seeks to extend and expand existing accommodation rights under federal law that currently require employers to provide lactation accommodations in the workplace by lowering the number of threshold employers from 50 to 2 or more full-time employees. DHR recognizes that mothers are the fastest growing segment in the nation's labor force. It is estimated that 70% of working mothers with children are under the age of 3 work full time. In recognition of the health benefits of breastfeeding and infants with mothers, the city current policy provides reasonable break time during the workday to express milk and requires agencies to provide that appropriate for this purpose. Accordingly, DHR supports Bill 18-0276 that serves the purpose to augment existing cities' policies. Thank you for your time.
Thank you. And now we'll hear from the Health Department.
Good evening, Madam Chair, members of the committee. My name is DePaul Nibber. I'm here on behalf of the Baltimore City Health Department. Thank you, Madam Chair, for putting forth this bill. The Baltimore City Health Department is firmly in support. And to explain why, I'm joined here by our Senior Medical Advisor, Dr. Shelley Chu, and our Assistant Commissioner for Maternal and Child Health, Ms. Rebecca Duneen. With your permission, I'd like to yield to Dr. Chu.
Absolutely.
Thank you.
And good evening, and just thank you so much, Madam Chair, and the members of this committee for this important legislation. And I also want to thank Rebecca Duneen, and then also members of Be More for Healthy Babies who are here today in support of this legislation, Andrea Williams Muhammad, and then Amber Summers as well. And I am the Senior Medical Advisor, but I'm here today as a doctor and as a public health official, and of course a mom. I'm expecting my second child at the end of February. And I also wanted to discuss the benefits of breastfeeding, I think, which we all know, which prevents infections and wards off illnesses, lowers the risk of asthma, ear infections, and sleep-related infant deaths. And it's even been shown to decrease obesity in children. And it's great for the mother's health, well-being, and also for bonding. And the American Academy of Pediatrics and the World Health Organization also recommends at least 6 months of breastfeeding exclusively, and then supplemental breastfeeding for at least a year. And the milk actually changes in its composition as the baby is growing, so it makes it the perfect food for the baby, and it's also a medical best practice as well. However, breastfeeding and pumping are not easy tasks, and I already have a toddler son, and I was very lucky in that I was able to pump and provide him breast milk for over a year, but I felt as if pumping was a full-time job on top of the job that I already had. And just logistically with pumping, there's just so many components to it. You have to set up the machine, then you have to have the actual pumping, and there's stress about making sure that I had 15 ounces a day that I had to pump, and then I had to break down the machine, clean up the equipment, and then I had to figure out how to store the milk. And I remember reading books and articles about how to pump successfully at work. But learning about these tips, that's not enough. And if we need the workplace support and accommodations. And while I was lucky at work to have the support and accommodations, I've also been in situations where I've had to pump in the bathroom, which is unsanitary. I've also had to walk to a different building, which also takes a lot of time, and it's not feasible for a mom to do this in the workplace. In Baltimore, we have low breastfeeding rates. It's 71% of moms have ever breastfed, and that's lower than the national average. And from national data, we know that it's only 25% of moms who breastfeed at 6 months exclusively. So we need hospital initiation, and we're very lucky in Baltimore City where many of our hospitals do support this, but we also need support in education. But these things are not enough if we don't actually have the workplace accommodations and support. So I want to urge a favorable report, and that really promotes the best practices to promote, encourage, and support breastfeeding, and also doing what's right for the health and well-being of babies and women of the city as well. So thank you.
Thank you.
Thank you, Madam Chair, and the councilmen, members of the Labor Committee. I'm Rebecca Deneen. I'm the Assistant Commissioner for Maternal and Child Health and the lead of the Baltimore City's Be More for Healthy Babies initiative. It's a decade-long strategy that's seen a 35% decrease in infant mortality, and I'm very pleased as a mom and as a public health official to wholeheartedly also support Council Bill 180276. It ensures that all working mothers have the time needed in a clean space in which to express and store breast milk. It supports the best possible nutritional sustenance for our infant residents in Baltimore City and promotes our city's efforts to reduce infant mortality and improves outcomes for these infants throughout their life course. Breastfeeding is especially important for babies born prematurely, and Baltimore City has a very high preterm birth rate. 14%, or almost 1 in 7 babies in the city, are born preterm. The bill promotes better infant and maternal health, supports an overall effort to reduce infant deaths, and upholds our citywide effort to increase breastfeeding rates through promoting breastfeeding across all agencies and businesses. Women who re-enter the workforce after delivering a baby must have accommodations to support producing what is the best food source for their babies. First, infants up to 6 months of age have to have the best outcomes if they're exclusively breastfed. And breast milk offers, as Dr. Shu has said, the perfect mix of vitamins, protein, and fat, everything a baby needs to grow. Breast milk also contains antibodies that help babies fight off viruses and bacteria, so that babies who are exclusively breastfed have fewer illnesses, ultimately meaning fewer sick days for women returning to the workforce. Second, babies who are breastfed have better survival in the first year, including a lower risk for sleep-related infant death, which is one of the leading causes of infant death in Baltimore City. Breastfeeding also helps mothers lose pregnancy weight faster and get into pre-pregnancy shape quickly, supporting a healthier work environment. Third, by passing this bill, we would demonstrate a powerful, unified voice about the benefits of breastfeeding in Baltimore City. Some of the current voices in the city are our Women, Infants, and Children's program that serves over 24,000 women and the children in the city. One of their primary purposes of the WIC program is to promote breastfeeding. We also offer breastfeeding aids, such as breast pumps. And we're, through this bureau, through the WIC office, we developed a citywide lactation support policy a few years ago for Baltimore City agencies. In addition, as Dr. Shu has said, we've had 6 of our 7 birthing hospitals now in Baltimore City offer breastfeeding support, including telephone support lines and face-to-face support. So a really important voice from our hospital agencies. And then Be More for Healthy Babies has trained community health workers to provide breastfeeding counseling and support, and offers free breastfeeding support groups. So there's a lot of voices in the city that are really organized around breastfeeding. This is another opportunity for us to bring people together and unify around something that's really promoting better health for Baltimore City. My own story, my now 12-year-old was breastfed until she was a year old. I was, as like Dr. Chu, allowed to breast pump in my office because the organization I worked at was baby and breastfeeding friendly. However, I had to travel a lot in my job and would often find myself in buildings where I would have to hide in a bathroom with a hand pump or head to my car to plug in my pumps to quickly express milk between meetings. When I think back on the gymnastics that this required and the constant worry I had that people would see me pumping, I shudder. If we're a society that honors its women and children, we can and should do better. So under the current law, certain employers are not required to provide accommodation for breastfeeding women to express breast milk. And this creates serious social inequities for women, with some having progressive workspaces and others without. More often than not, it's the women with lower paying jobs who lack supportive breastfeeding policies. This ultimately perpetuates the very health inequities we are trying to tackle daily in the health department. This council bill addresses this issue by requiring employees to have written policies for women returning to work, including topics such as minimum standards for break time and location space for expressing milk. It provides clear guidance for employers and employees and protects the right of our working mothers to make the choice to continue to breastfeed. So to be more for healthy babies, to literally be more for healthy babies in Baltimore City, we respectfully request a favorable report on this council bill. Thank you.
Thank you. I just have one question for you. Do you actually have the numbers where it says, because the community of the district that I represent, you know, these are not folks making 6 figures. These are people who work a lot of 2 to 3 jobs sometimes, and you actually have the data that says, because my workplace was not accommodating, or do you have those numbers?
We can look for that. We don't have it currently with us, but we could go back and come back to you with that.
Thank you. Just curious. Thank you. Okay. The committee will now take public testimony, so where I'm going to call the names, and if you just want to come up, we can go from there. So the first person is Gia McGinnis.
Hi. The Maryland Public Health Association thanks the Baltimore City Council for the opportunity to support legislation that would require employers to develop and implement lactation accommodation policies. Employer implementation would include providing a hazard-free, non-restroom lactation location for expressing milk, as well as a lactation break. This legislation would close the gap left by the federal break time for nursing mothers provision by extending protections to non-exempt employees and employees working for businesses with less than 50 individuals. As we've already heard today, there are numerous benefits of breastfeeding for both mothers and nursing infants. According to the Center for Disease Control and Prevention, breastfed babies have a lower risk of developing asthma, becoming obese, and developing ear and respiratory infections later in life. Mothers who breastfeed are less likely to develop ovarian and breast cancers, type 2 diabetes, and heart disease than non-breastfeeding mothers. Numerous public health and medical associations have endorsed exclusive breastfeeding for 6 months. In addition to the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the American Academy of Family Physicians also support this. The American Public Health Association also endorses breastfeeding for 6 months, in addition to supporting global maternal workplace protections and accommodations. The CDC's 2016 breastfeeding report card actually revealed that Maryland was one of 12 states to meet the Healthy People 2020 goal of 60.6% of infants being breastfed at age 6 months. However, there is a gap here in Baltimore City that needs to be closed. This legislation would broaden protections to ensure that Maryland remains a national leader in meeting certain Healthy People 2020 breastfeeding goals, while continuing to move knowledge into action in Baltimore City specifically, which needs to be done, and as we heard, is very urgent for women and families. Thank you for your consideration.
Thank you.
I just want to comment real quick. My mother had 8 children, 2 sets of twins, and back then there was no accommodation at all. So I'm really happy about this bill. And I read something in the paper, a young man in the Sun papers talking about the lactation accommodations. And it was funny, I was in Bowie, Maryland the other day, and I just went in Best Buy, and I walked in the bathroom, and what did I see? Lactation station in the men's bathroom. So changing station, but I'm just saying that Baltimore City has taken a big step in terms of doing this now, because a lot of other jurisdictions have it, but we, for some reason, haven't been doing it. So I just want to share that comment.
Thank you. Next we'll have Andrea Williams.
Good evening, Councilman Sneed and other council members. I'm Andrea Williams. I'm a doula and birth equity advocate. I am a national collaborator with Black Mamas Matter Alliance, and I also sit on the community advisory board for Be More for Healthy Babies. On behalf of their doula program, we stand in support of this bill. As 2018 comes to an end, we have a potential to place a positive note on the troubling conditions of maternal and infant health, especially in the African American community. In the year of the Me Too, Black Lives Matter, and Trust Black Women, the state of women and the challenges we have faced come to the forefront of the national conversation and triggered a national call to change, stemming from the possibility of a reversal of Roe v. Wade. Baltimore has the opportunity to send a resounding vote of support of birthing persons and their families. The lactation accommodation of workplace legislation is not just legislation impacting the workplace, but has potential to have a lasting impact on public health by being another tool of advocates like myself in educating Baltimore residents on the benefits of breastfeeding. In a city that ranks among the top 20 among cities for rates of breastfeeding, we're also in a city in which Black women are 3 to 4 times more likely to have a poor birth outcome. Over the 20 years ago, I began this work, not only to educate myself, but to educate my daughter and her children and my grandchildren. When I began my journey, breast pumps could only be obtained from a doctor's note. It was not covered by insurance. For me, the sacrifice meant that I had to leave my job, and my husband had to take another job to work at night so that someone would always be home with my daughter. So for me, this new legislation is not just about breastfeeding moms, but it's about the choice that a lot of women have to make in terms of breastfeeding. A lot of women who I work with choose not to breastfeed after the first 6 weeks because they don't have a job that is, 1, accommodating, 2, that supports them, or 3, has the access for them to even store their breast milk. So I stand in support of this bill. Thank you.
Thank you. Next we'll have Matt Quinlan. Am I saying that right?
Thank you, Councilwoman Sneed and members of the committee. My name is Matt Quinlan. I'm with Family League of Baltimore. I don't have actually much to add. Obviously, we heard the positive health benefits from the health department for both women and children. I would just like to sort of echo with Be More for Healthy Babies, and Family League is a partner in that strategy across the city, that when Be More for Healthy Babies, or BHB, formed in 2009, the racial disparity between Black babies and white babies was 1 to 5. And so Black babies were 5 times more likely to die before their first year of birth than white babies. And in the 10 years since BHB has been active, that disparity has been reduced by 50%. So it's been incredible gains through targeted and intentional strategies. And so I just want to stress that this bill is not just an issue of public health, but it's an issue of racial equity and racial justice, for many of the reasons that Andrea brought up as well. And then lastly, I'll just say that we're proud of this council for continuing to lift up these issues and to recognize that issues of women's health are actually issues of public health, and that efforts like this improve the overall health and wellness of the city as a whole. So for those reasons, we're in strong support of this legislation. And I've written testimony, if I could.
Yep. Thank you. Perfect. Thank you. Next, we'll have Susie McKenna.
Good evening, Madam Chairwoman and council members. My name is Susie McKenna, and I am here representing Mamava, a lactation room solution provider, as well as myself, a mother of 4. I am honored to be here to offer testimony in support of the council bill, and thank you for having me. This bill clearly spells out specific requirements for locations, conditions, and equipment that need to be available to working mothers that choose to nurse. Also, it allows opportunities for more women than ever because it reduces the threshold of employees from 50 to 2 or more equivalent full-time employees. It also ensures compliance with accountability measures. Having the specific room requirements and making sure that the rooms are near the employee in need is a win-win situation for everyone. Employees are happier because they don't have to take additional time off to go to another building or to go to some place that's 4 floors away on the other side of the building. Employers are going to be happier because their employees are happy. They're not going to leave. They're not going to be taking more time away and cutting into productivity. We've talked about the health benefits. From the employer's side, there's also the benefit of workplace programs that support mothers. It really does make a difference. It's validated by a 94.2% retention rate of female employees when you have a workplace program, and that's compared to the national average of 59%. It costs employers money when your women leave. As a mom, I personally had a hard time trying to pump once I went back to work. Lack of privacy, lack of space, lack of time. I didn't have a support system, and I very quickly quit. A generation later, we still have this issue. My oldest daughter is now a mother, and she faces those same issues. How have we not made progress from one generation to the next? Unfortunately, too many workplaces still consider a bathroom or an empty conference room adequate for pumping. It's not. Think about this. You wouldn't prepare a sandwich in a bathroom to eat, so why would you prepare a baby's meal by pumping in a bathroom? It's unsanitary. Meeting this need is how Mamava was born, out of necessity, by working mothers stuck pumping in ridiculous places, like discreetly in an airplane, at the back of a client's car, or in a toilet stall with an extension cord. We at Mamava are on a mission to support mamas and revolutionize the culture of breastfeeding. We believe that all mamas everywhere deserve a private, clean, and comfortable space to use a breast pump or breastfeed anytime, anywhere, no matter their circumstances. This bill sends a message that Baltimore is progressive. San Francisco's Act was just passed. The Friendly Airports for Mothers Act was just passed. You too can pass this and make a difference. So please support your mothers with this bill. This and generations to come will benefit from it. Thank you.
Thank you. Thank you. Thank you, everyone, for being here. I feel the same way. I've been that mother in the bathroom pumping or nursing, and it's not comfortable, it's not good, but you have to do what you have to do. And now I'm just happy that now when women go to work, literally they'll be able to have a safe, clean spot to pump. Does anybody have anything to add? No, we're good? Okay. So we have 2 amendments, but we're going to start with the first one. And so the first amendment is on your desk, council members and members of the committee, for a temporary lactation location. Do I have a amendment to move? Is there a motion to move the amendment?
So moved, Madam Chair.
Second.
Yes. So Vice Chair Robert Stokes?
Yes.
Eric Costello. Mary Pat Clark.
Yes.
Bill Henry.
Yes.
Yes. So, and Shannon Sneed, yes. This amendment moves. The next one is, the second one is the Law Department's amendment. You have it on your desk. Do I have a motion to move this amendment forward?
So moved. Second.
Great. Vice Chair Robert Stokes?
Yes.
Eric Costello? Mary Pat Clark?
Yes.
Bill Henry?
Yes.
Thank you. So this amendment moves forward, and so we'll now,
Madam Chair, are you ready?
oh, is there a motion to move the whole
Yes.
amendment?
Madam Chair, move the
Bill as
bill as amended.
Second.
Yes. And so, Vice Chair Robert Stokes?
Yes.
Eric Costello? Mary Pat Clark?
Yes.
Bill Henry?
Yes.
Right? And Shannon, yes. So this bill moves on with amendments. Favorable as amendment, and this concludes the, this concludes the hearing. Thank you, everybody.